Yesterday, what stood out for me is the employee assistance program. I didn't really know that it exists. Even if you do the physical exercise, even if you play some music, still you need that program in your company. And I didn't know that the employers have a hand. So they need to assist us. Yeah, that's what.
Good morning, everyone. I'm David from NASECO Seeds. What I learned yesterday was from Sandy's presentation about culture. He said culture is a perception that can't be measured, but we can measure the behaviors that influence the culture. Thank you.
I'm a safety officer, and I'm doing a diploma in health and safety. Starting from yesterday, there was what Mr. Alex Kakuku said about stakeholders and mapping. Really, it pushed me an extra mile, because working with contractors in the companies is not an easy business. And then I expect today to have a lot. Yes, thank you.
George Mugisha Mutifa works in SSF. Yes. But today, I expect us to keep time in whatever we're going to do.
My expectation, I'm expecting maybe by the end of this session, by the end of this conference, we may be provided with the software and the headset tools to go with them at our workplaces. Thank you.
When we speak about safety, I usually think of it as a product. And when I think of it as a product that we are selling as safety professionals, I also think of the marketing team. What you can see from the marketing professionals, they are moving from PowerPoint presentations to thinking out of the box. So today, from today's presentations and discussions, I'm looking forward to hearing more safety ideas that are out of the box, that can make us sell this safety product out there. Thank you.
My name's Dean Hornsby. I'm the HSE Methods and Audit Lead for ECOP. I thought things went really well yesterday, and one of the strongest messages I thought came from Dominic, and it was about it's okay to not be okay.
Yes, I welcome you all. I take the honor to welcome you on the second day of our conference, the first of its kind in the country. My name is Enoch Titus Sesanga, and I serve as a chairperson for our great association, SHAU. The fact that each of us has a cause for ensuring that the workers are safe, but also we continue to improve in the various areas that we discover. So collectively, today on day 2, we look forward to hearing from you. We look forward to getting to know about the risk assessment and the various arrangements that you have set in place within your various expertise, but also organizations. We appreciate all the lessons that you've shared in day 1, and we look forward for those that you'll be sharing with us today. We believe in a collaborative approach, and we believe that together we can bet better. We are better together. Thank you so much for staying with us, and we encourage you to participate even more on our day 2. Thank you very much for a safe and healthy nation.
Here I would like to share my experience. Now we all know that this construction is going on coming since centuries, and these acts, they are prepared after getting lesson from the site. When we see that at the site something is not happening well, it come and we ask consultant or we ask the ministry, they design it. So now the issue is that all these consultant and contractor, they are responsible for actually implementation. Now, When I started my work about 25, 30 years ago, some of you were not even born. At that time, we called contract document. Contract document were only 10 pages. It was giving only about bill of quantity or condition of the contract. It was not talking about environmental, social, health issues. But now, if you see our contract document, it is 700 pages. There is a separate volume of the environmental, health and safety issue. How we got that? Thank you very much to the ministry. Thank you very much to the OSH. They have given the guidelines. And our implementing ministries, for example, Uganda National Road Authority, have a lot of respect of all those acts and all those regulations, and we implement it. Now the question comes, I'm sure in this group, there are some employer, there are some consultant, there are some contractor. Now these three parties implement project is one. So now all roles are very clearly defined in the contract. So here the lesson is that if contractor and consultant performs well, then the employer should give him a sort of a letter of appreciation. But if unfortunately consultant and the contractor are not performing well, then employer must give them some action for non-compliance.
We know that now, as opposed to say before 2018 when the Building Control Act came into play, that the sole responsibility of a developer, and I believe all of us here are developers, current or potential, the sole responsibility of a developer is to get a professional in place. Once that is done, they've done their role, because them as developers do not understand construction and safety issues. So the developer should engage you as an occupational safety and health, or health and safety and environment expert, to advise him and ensure that his construction or his project is done safely with as minimal, if not zero, injuries and the attendant casualties, as we will see later. We know that there is a requirement for Class A, and I think Class A buildings, to ensure that the Occupation Safety and Health Department within the Ministry of Gender, Labour and Social Development is aware of the developments, and the reason for that is for them to keep an eye on the provisions in there. We know that demolition can also be an issue. The public tends to underrate that. We are seeing accidents, fatal accidents in our environment where demolitions are mishandled and people are getting injured due to safety concerns. Just to reiterate that a demolition is also a building operation, and you will require a building permit to do that. The current framework also provides that we have maintenance now being a compulsory requirement, and you can be required to make good, and if you don't, then the building committee can do the same at your expense. Where are the health and safety professionals in an environment which is killing 3 Ugandans every month and injuring 3 Ugandans every month? When you kill me, I am not just as an individual. I have 5 children, I have a wife, I have 2 elderly parents, and a few others in the village who look up to me. So when I die in a preventable accident, you have killed a clan. I thank you.
Thank you so much, and I think you're doing an amazing job. One thing I want to say is, of course, connected to what Mr. Subash was saying. We have BOQs, we have projects, we do write-ups, and before the project starts, the people owning the project have their own BOQ. Then comes contractors, they bid for the job. Then we take the cheapest one with $1,000 a month to cover health and safety. And then this is a very big problem, I think, especially in government projects, because we take the cheapest tenderer, and they can get away with a lot. They can get away with authorities, because once you, the HSE person on site is stopping the project because of unsafe conditions, The owner of the project, I would refer back home, probably the director for water authority, will call the director for safety, and then the project goes. So end of the day, I think probably we need to review how do we handle the projects, and the responsibility for safety ends up with the owner of the project, the senior contractor on site. As a HSE person, I would say this is not safe, can we stop this job? And then they say this job goes, then the HSE person is rendered helpless. Thank you.
First of all, how many people has been in jail from your office? From your office, because everything that you talked about here, all the way came from your office. Do they have insurance? Any building construction, do they actually have insurance to cover? Has there been what we call safety in design? From the beginning, when the architect is there, do they put all those things on? I don't think so. Now, from your office, has there been any inspector attached per building? Then, the practitioners, do they actually submit all the safety documents required from the beginning when they're about to start the job, including the risk assessment to be done? So that's where I'm going to go. But I have a lot more for you when I see you one-on-one.
My question is, do you have inspectors do you have such an institution that can go for inspection before the building is being authorized to operate, or during the time of construction, before we put the blame to the HHSC team? Does your institution have those people who goes for inspection and check and approve the risk assessments? Thank you.
Before you send out a bid notice, you should have done what engineers would call an engineer's estimate. And the assumption that the engineer's estimate will be the opinion of the client on how much that project would cost. We want Ugandans to buy into the need to ensure that their environment is as safe as possible. Thank you very much.
We learn from the field. Now, in some projects, they have not a must to give contract to the lowest. They do technical evaluation before. So it means now a vault of bidding has been done into two parts. One technical evaluation and one financial evaluation.
First of all, allow me to take this opportunity also to welcome you as the founding president and interim chair. You're most welcome, all delegates. Thank you for sparing time and coming to share with us on our annual conference of occupational health and safety. You're most welcome, all delegates. I wanted to possibly take you into a little bit of risk treatment. You've identified the risks. How are you going to treat these risks? So there are different ways someone can do what? Do the treatment of these risks. And the key thing is to follow the hierarchy of controls. That is key. So if you're a safety person here, or you're trying to be a safety person, you're in the process of becoming one, and you cannot identify hierarchy of controls, then there is a problem there. Those are the first key things we have to consider. But what has been so often is that most industries or most organizations, they look at the last control, which is PPE, as the key thing. PPE can even be ignored so long as you've taken the first controls: elimination, avoidance, substitution, engineering controls. The engineer has just presented some good paper here. But what engineering controls are we putting in place to control these risks? Thank you so much.
Thank you. We'll go into our second question to our second panelist, Mr. Norman. How can organizations build a culture of proactive risk management? Since we are looking at proactive risk management and how it can build a resilient workplace.
I'm going to give you one example. If I'm going to rent, let's say, an office space, and it's on the first floor, what's the first problem? The first problem is that I'm going to pay the highest rate, right? If I go on the 5th floor, I may get a low rate. But what is associated in both two ends? There is risk associated. On the 6th floor, if you have your people working up there, it's a higher risk. So, all that, if you understand your risk profile, it's very easy to now go on and do the assessments and everything. That's where our systems, our risk management to create such a resilient workplace fail, and we end up just having white papers. Thank you.
Thank you so much, Norman.
For a building to collapse, it means also some substandard materials and equipment were also found in those buildings. So I will want to hear from you if this happens here, if it does, how are you dealing with this? The issue of fire trucks you mentioned, and this also I've also seen in Nigeria and a couple of countries in West Africa. We have started prioritizing aesthetic above safety, and that is beginning to create a whole lot of problem. I went to do fire audit in a facility some time ago. I mean, they had a good system, but in an attempt to beautify and make the building more aesthetically appealing, so all the safety issues were overrun by the beauty they brought into the building. So most times fire trucks are able to come when you call them for response, but fire trucks are not able to go beyond a certain dimension, because where the fire truck would have accessed the building from have been redesigned and beauty has become a priority. So I don't know if you have that here, but this is what we're seeing in several places that happens. And even the issue of the emergency door you mentioned, I mean, the standard says the doors must open in the direction of travels. And we've seen several of those doors, they were actually functional, but aesthetic again and security also take preeminence. So we've seen several of those emergency doors in facilities being replaced with security doors. So you find out that aesthetic and security have strong contention with safety, and this has been prioritized and putting people's life at stake and compromising safety standard within organizations and properties. So I just want to see your position on this, if this really happens also in Uganda. Thank you so much.
In Uganda, the entry in terms of material on the market, cement, steel, and other materials, is that you must be certified by the Uganda National Bureau of Standards, which is an equivalent of the standards body you talked about, UNBS. The weakness or the gap that we have in the sector is that once UNBS gives you this certification mark, we don't feel the enforcement of the quality standards. It's one thing for me to have the mark from UNBS on this bottle of water, but is that mark telling me that this particular bottle which I'm about to drink is of quality, or it only tells me that at the time that Aquafina asked for certification, the sample they provided was proper?
Our topic today is leadership commitment, the foundation to achieving a zero-harm workplace. And you'll hear the word zero harm echoed throughout the presentation quite a lot. And this morning, we're going to speak about some practical examples, give you practical things that we're doing at ECOP with respect to achieving that zero harm workplace. So if we just go to the next slide, I'll hand over to Richard.
I know most of you in your organizations are already doing something similar to this, but at ECOP, it's basically a structured visit by the senior leaders in the organization where they go to the various operational sites, and the purpose is simple, for them to assess and reinforce the commitment that we have in relation to the ECOP HSE standards. We have a target that has been set, and within this year, the ECOP leaders are supposed to visit 30 sites within the course of the year. And the process of these visits is quite simple. The leader has to start with preparing for the site visit, and during that preparation, they get in touch with the representatives at the site and plan out the dates and the details. They then go ahead to do the tour when they're at the site. They do a walkabout tour to understand the different activities that are happening. And within that tour, they also dialogue with the different workers, the unskilled labor, the skilled labor, the supervisors, and etc. And then at the end of the tour and the dialogue, they have some debrief at the sites. And the debrief sometimes could be with the bigger group of the workforce or with the selected supervisors or leaders at the sites. When they return back from the sites, they prepare a report that they submit to us, the HSC team, and then the responsibility to follow up on the actions that they've picked up actually lies with the senior leaders. All our workers and all our contractors are now speaking the same safety language. They are referring to the same safety guidelines and the safety rules at the site.
So reducing the pollution will going to evolve our health performance, but at the same time, the processes that you're following in order just to reduce that pollution, it may also have an impact on our health and safety. So that's the paradigm shift. Like sooner or later, we will be actually a very sustainable business, maybe not now, but in the near future, or we are actually at least moving towards the sustainable model. So circular economy considered to be a little bit different from the sustainability, but at the same time, it contributes to the sustainability by a way or another. So this is where we actually having the linear business model, and this is actually considered to be the common business model in which every niche company following right now. And this is where we actually just extracting from the nature, making, and then disposing. I will not go actually in detail about the circular economy, but we will going actually just to give you some just brief example on how it works. And from that example, you will go and actually just imagine how the circular economy can be. The most important thing is about testing the model that we are operating with and testing how viable is it and how safe is it for our workers. And adapting and following the practical transitional methodology is essential for a smooth circular economy transition. And this is where it matters, how we will go in actually to make the transition from the linear to the circular. So in midway, we need just to be involved as an IHS practitioner. So thank you very much for that.
Just stretch a bit, spell your company name with your body.
You're most welcome, Mr. Eric.
I want us to appreciate the first thing. OSH is a shared responsibility, not about the professionals sitting here. We must come from the different backgrounds, and each person in the different background has a role to play in ensuring that there is an improved practice within the OSH at the workplace.
How can we leverage cultural diversity to build strong partnerships for safety?
So in a workplace, we have diverse cultures, strictly from where they come from. You find mostly in Uganda, we're looking at different regions. They have got different perceptions, different cultural practices. But when we come in a workplace, there is the goal that you're trying to push and a certain culture that you need to have as an organization. So it is very important to appreciate that there's different cultures purely from where people are coming from, their backgrounds. They dictate how they perceive safety practices. They dictate how quickly they can communicate amongst peers in the workplace, or how quickly they can really understand the safety information in the workplace. So as a professional or as someone who is trying to build this safety culture in the organization, it is important to look at your workplace or the region in which your workplace is located. There's that culture that is coming out. How do people behave in that region where your business is situated? You are going to find people in the northern country have different perceptions towards safety, people within the central or people within the southwest. So as an organization, there is a culture that you want to build. At some point, it will conflict with the culture of the area, and it will definitely conflict with the different people you have within the workplace, because they've come with different norms, different perceptions, and different values. So as an organization, is to understand these different cultures. There is a skill set, a certain kind of culture we bring to the table.
Some people are open communicators. They're straightforward. Others, they wander around to put across information. So in a workplace, when there's a strong topic you want to put out, you need people who will communicate it strongly. So at the end of the day, you have to leverage on these different cultural perception. As a safety officer or a safety manager or safety department, you shouldn't look at all these practices you're trying to put across in the business to come from your own section. You need to look around the business and see who are these people with these strong perceptions about safety? Who are these influencers in the workplace? And basically teach them so they can go and influence in the different areas.
We are not yet there. We need probably a bit of sharpening, but there is some causes that identified to certify people in the field. So that is called the National Occupational Health and Safety Cause. And then later on, the authority responsible developed a system of registering private inspectors. So they register these inspectors and they give them their rules and what to do. They make sure they have the right equipment and they give them all the reports and statistics. All the benefit is being shared between them and the private inspectors.
Like we do hold, let's say, a monthly meetings, safety committee meetings on a monthly basis or a quarterly basis. But you as the stakeholder, you as a safety officer, you should be able to hold your own meetings with both management and workers. Like we saw in the video here, you should not be staying in the office all the time. We should be able to go and meet people in various places they are working in, and then be able to ask them about their issues on a personal level.
Thank you so much, Mr. Eric.
They talked about there was something to do with the challenge with people speaking up. That is everywhere. So recently we just had, with Sunday, we organized a session where we met all the forklift operators. We realized that in 1 week, there was a certain week where we had 10 incidents. Fortunately, they were not related to injury, but they had stock loss. So we were asking ourselves, why 10 incidents? The one was a near miss. So when we did that heart-to-heart conversation, we realized that we were not giving the forklift operators time. There was so much that they had to share with us. But when we met them, they told us, you guys are very proud. Your boss is up there. You pass here in the yard and all you're telling me, put on your PPEs, what? So they were not happy. So because of that, they thought we were too harsh to them. Every time they made any error, it was consequence management. So, what happened was after that session, surprisingly, the subsequent weeks, we had no incidents. So that is one of the things that you can take. Daphne mentioned that you have to come down on ground to share with the rest.
My other question is, how can technology enhance collaborative approaches at our workplaces today? Thank you.
In all organizations I've gone through, there are two people who give us problems, and I want to know how we can collaborate with them. Number one is the finance people. They pretend to be very busy, and the people give us problems in terms of approving money. Two, the people who are called maintenance people, workshop people, the biggest problems we have in industries. How do we collaborate with these hard-headed people? Thank you.
Thank you so much. Good afternoon.
My name is Nanis Kanana. I'm the IOSH East Africa consultant. Demographic changes from the research is that where the world is going right now, we likely to witness two major sets of age group. One is a group of workforce that are a bit older and a much younger generation. And I'll just pose two questions for us. And one of them is, you as a OSH professional or the stakeholder of the OSH industry, with all these changes that are taking place, either because of the political, technology, climate change, and other forces, how well are you prepared? Okay, thank you, everyone. If you have any questions regarding the presentation, you want access to the report, you can find it online. But I'm here to support. I'm here until tomorrow afternoon. Please feel free to reach out to me. You can have my contact, and you can also walk to our booth for assistance. Thank you.
I'm a civil engineer. I worked as a site manager, and then I moved to this organization in Germany responsible for health and safety of workers and others by law. We have around 40,000 employees. It's a huge organization, very strong. We are running 14 huge clinics, rehabilitation centers, and around 54 huge training centers. We are training around 1 million people a year. If you went to industry, it doesn't matter which country, we have so many languages, but you as an employer are obliged to train them. But how can you speak 15 languages? How can you give your training material in 15, 20 languages? So we developed something without language. The approach was identification of the most common sore points concerning safety and health in construction industry, drawings of bad examples next to good ones, no written language, can be used worldwide, available for free via the website of ISA Construction or ILO. At the moment we have 43 scenarios. Yeah, this is, if you go to prevention, this internet address, you have it on the presentation and you can use it. So we are in time, only 4 minutes late, so thank you very much for listening. I'm here, and if you have any question, contact me. I'm happy. Thank you.
Now let's look at the Vision Zero in the Africa region. African region is somewhat still in its infancy with regard to the Vision Zero global campaign. However, there are a number of pockets, including individual organizations and country-specific programs that are well aligned to the objective of Vision Zero and the principles of seven golden rules. The main objectives for the African region is to extend Vision Zero and share the tangible results among all African countries.
Gentlemen, as Uganda, we get the wonderful opportunity, and you and I, we get the wonderful opportunity to witness the launch of Vision Zero in Uganda.
I have the pleasure, on behalf of Africa Vision Zero Network, to officially launch Vision Zero Network here in Uganda.
Thank you so much. Officially, Vision Zero has been launched in Uganda. This is your country. A round of applause for yourself. And I'm glad to also say that you have become the first country launching Vision Zero in Eastern Africa. That's a great feat.
Yeah. At this point in time, I would like us to sign on this board, the ones who are here with us.
Construction safety. Ladies and gentlemen, after they are done, we shall have top management SHAU also sign. Then our beloved sponsor representatives. So SHAU leadership, please be closer.
We focus on, we can do it, we can bring.
So as we come to the conclusion of the inaugural Occupational Safety and Health Conference, I want to take this opportunity to express my deepest gratitude each of you and your participation. I know we've gone through a lot in these 2 days. A lot has been learned. It has been an extraordinary gathering of minds, and I'm inspired by the passion and the commitment of you all participants that you have shown and demonstrated towards advancing workplace safety and health, and this should be commendable. Our theme was advancing workplace safety and well-being, a collaborative approach for excellence, and really it has truly resonated through this conference. As we went through most of the topics, you could see that we were really on the theme for the conference. But I want to say that this has been a successful conference to us, and I want to take this opportunity once again to invite ECOP for the closing remarks. Thank you very much. God bless you.
Ladies and gentlemen, good evening. And thank you very much, Mr. President Edgar, for just having the vision with your team to arrange this inaugural SHAU conference. When we were invited to participate in the conference, we didn't know what to expect. We made a blind commitment, but I must say that what we have seen over the last 2 days have far exceeded our expectations. So really want to give you a round of applause for that. I like Dr. Ehi's link between physical activity and mental health, because I think I just cast my mind back to April when we launched what we call the 1443 Pipeline Challenge. And it was a health challenge where groups of 20 groups of 12 individuals, we challenged ourselves to walk the 1,443 kilometers virtually. And there was such a buzz in the company and everybody was talking about it. It was very competitive, but people were happy. They were genuinely happy because everyone was out exercising and walking. And when you spoke about that, that triggered that memory in my mind. For the paper presentations, those were well received. Being a paper presenter ourselves, we know the work that went in writing the abstract and then having the paper written and then doing the presentation. So really, really, really appreciate all the work that went in to presenting your papers today. And I think even if we take away just one item from all that we have learned, we'll go back and make our workplaces a better place. So thank you very much for having me.
Thank you very much, Dr. Stacy. So ladies and gentlemen, this conference was officially opened by the Ministry of Gender, and it is going to be officially closed by the Ministry of Gender. I'll hand over to Mr. Alex Ogwal, who is still here. He will close the conference officially, and he will lead us down to the cocktails. Probably will take the first cocktail of the day.
For the last 2 days I've been here, I realize as a government worker, as a safety professional, I realize people expect a lot from government towards the cause of safety at workplaces in this country. So as an individual, I have this, and I need to take back to first our departmental meetings. How do we perceive ourselves as we sit in those offices? You also, how do you perceive yourself in those offices? Because at first when you are looking for a job, your perception is to get a job, get pay, and you change your lives. That is the initial perception. But as time goes on, what happens next? Possibly the perception changes. In most cases, people have reflected or have a negative perception on government workers. One, they are lazy. They don't attend to issues up to the conclusion. But me, I changed my perception and how I perceive things some time back. I've been in this job for 30 years to date. So I changed some time, about 15 years ago. That is how I change, how I perceive. Most people who have interacted with me or they have come to that ministry, they see how I treat people. Others call me, says, where are you from? Because if you have come there, I need to attend to you up to the logical conclusion. You need to live there when you are satisfied. So this is what we should do. But we need your support. So keep calling us. Put us on pressure. If you try, this officer is not responding to you, you try another person. It maybe he will respond. Thank you. On those very many remarks, I wish to declare this 2 days conference with a beautiful theme, advancing workplace safety and well-being, a collaborative approaches for excellency, officially closed.